An assessment of the home environment is important as it helps to identify issues or concerns that may impact an individual or family. This identification can help nurses address health promotion and disease prevention. A home safety assessment was conducted on a single mother's apartment in Sentinel City, during which health, safety, and environmental hazards were noted. Candace Conway is a pregnant single mother with 2 young children, aged 6 and 2. In the family support assessment interview, Candace noted that she has trouble paying rent and other bills, in addition to being worried for her children's safety when her boyfriend is around. Because of these concerns, a home safety assessment was completed on Candace's apartment to assess for further issues that the family may be facing in the home setting. While walking through Candace's apartment, many hazards were noted. Doors and windows were left open, there was a mouse running around the inside of the apartment, cleaning products were left out in the open, and the same for many medication bottles. There was a hair straightener left plugged in on the bathroom sink. Extension cords were being used with the wires crossing the floor in walking areas. Cigarettes were burning in ashtrays all over the apartment. Drug needles were on the counter and alcohol was out on the table. Scissors were left out within children's reach, and the apartment overall was very cluttered and messy. Piles of clothing all over the place, food spread across the counters and even on the floor in the bedroom, and trash was overflowing. This apartment does not seem to be a healthy place for anyone to be living, especially not 2 young children and a newborn when the baby comes. The number 1 health hazard present in the apartment is the presence of burning cigarettes, and the reason for that is twofold. The cigarettes burning in ashtrays presents a potential for fires, and tobacco smoke is harmful to human health, children in particular. Effects of tobacco smoke in children include asthma, sudden infant death syndrome, bronchitis, pneumonia, and other respiratory diseases. It can also have an effect on the developing fetus. In addition, exposure to tobacco smoke can cause lung cancer, irritation to the eyes, nose, and throat, and may affect the cardiovascular system. The second most dangerous health hazard in the apartment is the medication bottles that are spread throughout the tables and on counters. A study in the journal Pediatrics found that accidental poisoning was the second leading cause of injury in their study of children aged newborn to 3 years, and more than 2/3 of those injuries were by medications. The highest priority safety hazard in the apartment is the presence of drug needles on the counter, and this is number 1 priority for multiple reasons. This presents a safety hazard for the children who may find the needles and accidentally stick themselves, causing an injury and potentially overdosing if there are drugs present in or on the needles. Substance abuse by parents is cause for a high rate of child abuse and neglect. And if it is Candace taking intravenous drugs, her pregnancy and her fetus are at great risk for problems, including stillbirth, growth retardation, preterm birth, newborn mortality, SIDS, and withdrawal symptoms in the infant. One of the Healthy People 2020 objectives is to increase abstinence from illicit drugs among pregnant women, so it is apparent that this is a very dangerous issue. The second prioritized safety hazard is the cleaning products that are strewn about the apartment, not in locked cabinets or out of reach of curious children. Chemicals and cleaning products are another source for accidental ingestion of poisons, especially among toddlers and preschool-aged children who are beginning to climb and explore. Lastly, the top environmental hazard in the apartment is the open window. Again, young children are curious, beginning to climb and explore wherever they can. Toddlers have a limited concept of body boundaries and have essentially no fear of danger. The second priority environmental hazard is the mouse running around the apartment. The invasion of the home by pests is a direct threat to health, as they can be carriers of pathogens, diseases, and allergens. The main threat of pests, such as mice, is the contamination of humans' food and water through carried pathogens, infected food particles, or animal and urine feces contaminating the home. The main recommendation for addressing each of these hazards is through teaching Candace about the dangers of each. For the cigarettes, Candace should be advised to quit smoking for the health of herself, her children, and her unborn baby. And if she cannot or will not quit smoking, she must not smoke in the apartment or in a vehicle with children present. In addition, she should be advised on fire safety within the home. For the medications and cleaning products that pose poisoning risks, those products should be stored out of children's reach, out of sight, and within a child-proof locked cabinet. The open window should be closed and locked so that children cannot climb through it. The pest situation ideally should be taken care of by a professional, though with Candace's monetary restrictions, this is likely not possible. Instead, Candace should then be taught about the health problems that could be caused by mice being present in the home, and to put out traps and clean the apartment so as to not attract any more pests. Finally, addressing the hazard of the drug needles must be dealt with carefully. It needs to be determined whether it is Candace that is using IV drugs or if it is another adult in the home. From there, further recommendations can be made. Removing the hazard of drug use in the home may not be easy, especially if the user or users deny that there is a problem. Therefore, removing the children from the potentially dangerous environment might be the more appropriate option. Florence Nightingale recognized that the connection between human health and the dwellings of the population is one of the most important that exists. Home safety assessments are important to assess potential hazards that patients face in the community setting. Oftentimes, home environment affects a person's health, so it is necessary for a community-based nurse to have an idea of what the patient's living situation is like so that they may better be cared for.